We've heard it many times. Widespread testing for COVID-19 is key as we start to reopen our economy. But can you get a test if you need one? The I-Team's Andy Alcock takes a closer look at testing in Missouri.
Ken HUTCHERSON currently lives at a long-term care facility called Garden Village in the Northland. About a year and a half ago, the 77-year-old was in a bad car accident. He still uses a walker to get around. A few weeks ago, HUTCHERSON said he received a notice with his meal. It said a Garden Village resident had tested positive for coronavirus. Concerned, he reached out to Garden Village management and then spoke to a woman with the Kansas City Health Department to see if he could get tested.
I said, do you have any intention of testing any of us besides that one person? Well, she said they didn't have the resources. And so apparently the answer was no.
On Wednesday, Missouri Governor Mike Parson said testing will be key to preventing any potential future outbreaks. He said between the state lab and private testing, up to 60,000 tests could be done per week in Missouri if needed.
We are good on supplies, and our business is continually every day picking up on the testing.
In mid-March, Marcia Waters was reassigned from her job as a cardiac rehab nurse to this coronavirus drive-through testing facility at Truman Medical Center. She says the people getting tested here are either getting checked in advance of medical procedures at the reopened hospital or go through a screening process. Truman is also doing testing at remote sites throughout Jackson County 3 days a week to reach people in their communities, including Friday's visit to Blue Springs. Truman will give free tests to patients without insurance.
They're very thankful. Some of them are scared. They just want to make sure that the symptoms they're feeling aren't COVID.
But Waters believes significant antibody testing of asymptomatic people will need to be done to have a better idea of the virus spread.
I am pretty sure there is a lot of positives that we're not aware of.
As for Ken HUTCHERSON, he and a Garden Village married couple decided on their own to go to an urgent care facility to get tested.
I keep hearing that there are people who have it and don't have any signs or symptoms and could therefore be contagious without even knowing that.
On Thursday, a day later, HUTCHERSON had his test result negative. I'm investigator Andy Alcock, 41 Action News.